A 30-year-old woman seeks evaluation at a clinic complaining of shaking, chills, fevers, and headaches for the last 3 days. She recently returned from a trip to India where she was visiting her family. There is no history of loss of consciousness or respiratory distress. The vital signs include temperature 102, respiratory is 19, blood pressure is 120 by 80, and pulse is 94. On general examination, she is pale and the sclera is jaundiced. Laboratory examination shows hematocrit 30%, total bilirubin 2.6, direct bilirubin 0.3, and a peripheral smear is as shown in the picture. Which of the following is the most severe complication of this condition? So these are the options. Option A is heart block, B is facial paralysis, C is cerebral edema, D is aplastic crisis, and E is rheumatoid arthritis. This is the question. This is the options. Time starts now. Okay. So we go with the majority option and proceed to the next. Okay. So this question, anyone would want to tell me what is the diagnosis? All right, malaria. So you want to get more specific, which kind of malaria? Yes, very good. Falciparum. All right. So this is basically, you can see the ring-shaped structures in this, in the RBCs. This is basically your Plasmodium falciparum. Okay. So these are the ring-shaped gametes, and if they were banana-shaped, you must have very well attended in your pathology classes. That is the other malaria, right? Okay. And when it's falciparum, it is ring-shaped. When it is normal malaria or something, it is the banana-shaped or something which you call it, right? So basically, Plasmodium falciparum, what it does is it causes a lot of microvascular complications. Why it causes that? Because the infected RBC cells, they adhere to the endothelial cells. All right, so they adhere to the endothelial cells, they block the blood flow, they cause clots and all that stuff. This usually happens in your brain, kidneys, lung, and GIT. Okay, and it is usually very, very fatal. Okay, so yes, that is how it causes your cerebral edema. It can cause kidney damage, lung damage, and all that stuff. Okay, so that's all you need to know. It can cause your acute respiratory distress syndrome, shock-like syndrome, and diarrhea. Everything. Okay, this is very direct. So if I had to ask you to rule out the other options which could have confused you, maybe facial paralysis or heart block, these are usually common with which bacteria? Anyone wants to tell? Which disease? I'll rather rephrase it better for you. Yes, Lyme's disease. All right, very good. Okay, so I think someone had answered aplastic crisis also. But yeah, aplastic crisis is not really seen with malaria. It is usually seen with your parvovirus B19 or something. Okay, especially in sickle cell patient. A normal parvovirus B infection in a normal person won't really cause aplastic crisis. But in a sickle cell anemia patient, it will increase the load on the patient, and the cells are already sickled and damaged. After that, you have parvovirus, which will affect your progenitor cells. So in a way, you will end up having aplastic crisis, right? Should I proceed to the next question? Okay, someone has asked me about sensitivity and specificity. All right, so it is not really important from this point of view. Okay, like I had mentioned in the previous question, my basic thing which I wanted to tell you, you will learn that better with stats whenever you have a stats class or something. So always remember specificity. There's a mnemonic which is there in your first aid also, SPIN. Okay, so specificity means it rules in a disease. That means if the test 100%, if it is 100% specific and it turns out positive, that means there is a very high chance that the disease is present. Okay, and specificity, there's a mnemonic in your first aid, spout. Okay, so snout, sorry, not spout, snout. Okay, sensitivity. So it basically rules out the disease. Okay. So if a test has 100% sensitivity and it turns out to be positive and it turns out to be negative, sorry. So that means the disease has been ruled out. Don't worry about it right now. Until and unless you don't do questions, you won't understand this concept. It'll be a little confusing. I just try to make a correlation and get it in this. All right. Don't worry about it. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.